Welcome to the GoalZero Toolbox Talk series. Today's Toolbox Talk: Emergency eyewashes and showers. The first 10 to 15 seconds after exposure to a hazardous substance, especially a corrosive substance, are critical. Delaying treatment, even for a few seconds, may cause serious injury. Emergency showers and eyewash stations provide on-the-spot decontamination. They allow workers to flush away hazardous substances that can cause injury. Accidental chemical exposures can still occur even with good engineering controls and safety precautions. As a result, it is essential to look beyond the use of goggles, face shields, and procedures for using personal protective equipment. Emergency showers and eyewash stations are necessary backups to minimize the effects of accident exposure to chemicals. Emergency showers can also be used effectively in extinguishing clothing fires or for flushing contaminants off clothing. Consult your local occupational health and safety agency in your jurisdiction and check relevant legislation for any requirements to install this equipment. Currently, there is no Canadian standard for the design or placement of eyewash stations or emergency showers. As a result, the American National Standards Institute, ANSI, Standard Z358.1 to 2014 emergency eyewash and shower equipment is generally used as a guide in Canada and the United States. ANSI Z358.1 to 2014 does not specify how long the affected body part should be rinsed. It does specify that the equipment installed according to the standard can provide flushing liquid for a minimum of 15 minutes. Other references recommend a minimum 20-minute flushing period if the nature of the contaminant is not known. If the SDS is available, it will normally specify the amount of time for flushing. The flushing or rinsing time can be modified if the identity and properties of the chemical are known. For example, middle. 5 minutes for non-irritants or mild irritants. Middle. 15 to 20 minutes for moderate to severe irritants and chemicals that cause acute toxicity if absorbed through the skin. Middle. 30 minutes for most corrosives, and
middle. 60 minutes for strong alkalis, e.g., sodium, potassium, or calcium hydroxide.
In all cases, if irritation persists, repeat the flushing procedure. It is important to get medical attention as soon as possible after first aid has been given. A physician familiar with procedures for treating chemical contamination of the eyes and body should be consulted. Emergency showers are designed to flush the user's head and body. They should not be used to flush the user's eyes because the high rate or pressure of water flow could damage the eyes in some instances. Eyewash stations are designed to flush the eye and face area only. There are combination units available that contain both features, a shower and an eyewash. The need for emergency showers or eyewash stations is based on the properties of the chemicals that workers use and the tasks that they do in the workplace. A job hazard analysis can provide an evaluation of the potential hazards of the job and the work areas. The selection of protection, emergency shower, eyewash, or both should match the hazard. Portable safety showers and/or eyewash stations can be rented or purchased. In some jobs or work areas, the effect of a hazard may be limited to the worker's face and eyes. Therefore, an eyewash station may be the appropriate device for worker protection. In other situations, the worker may risk part or full body contact with a chemical. In these areas, an emergency shower may be more appropriate.